Crisisonomy, a new topic or approach in addressing crises, academic pursuit or practical approach. It is my intent to show how this can be applied in practice. But first, to all of you, on behalf of Asian Disaster Preparedness Center, or ADPC, I would like to welcome everyone to the 21st Asian Conference on Crisisonomy, or 21st ACC. It is our great pleasure to co-organize this important event with Dr. Jeong-Eun Lee and Dr. An Chen and Dr. Kyoko Kitagawa, the members of the founding committee of Asian Association of Crisisonomy, National Crisisonomy Institute of Changbuk National University, and our esteemed partners from the region. ADPC is an autonomous international organization dedicated to the work on reducing impact of disasters in Asia and the Pacific region. With over 100 staff in 10 countries throughout the region, we have been working closely with the governments, local administrations, international and UN agencies, non-government organizations, private sector, civil society, and vulnerable communities since 1986. Over the year, we have supported and contributed to the development and implementation of major global framework on disaster risk reduction, such as the current Sendai framework, the previous Hyogo framework for action, and ADPC has accumulated a wealth of information and knowledge on disaster risk reduction. A lot of progress has been made, and we have seen that the mortality rate has decreased over the years, but with urbanization and unplanned development rampant in our region, we've also seen steadily increase of economic losses in the past years. I attended the Asia-Pacific Partnership for Disaster Risk Reduction Forum a few weeks ago, and with the national reported data for the Sendai framework monitor, it validates what we have seen on the ground. But we are now facing a great challenge through the COVID-19 pandemic, and unfortunately, it is expected that the mortality rate will increase when we see the next round of Sendai reporting in March of 2021. The COVID-19 had also introduced other new aspects of disaster resilience in the new norm of physical distancing and restrictions on travel. How do we manage an evacuation due to an impending cyclone or a typhoon during COVID-19? How do we ensure that hospitals can still function given the influx of COVID-19 patients and have a constant stream of medical supplies ready? How can we continue to engage government officials and relevant stakeholders? And more importantly, how do we continue to train when participants are not allowed to travel? These are all very important issues that we faced or are facing, and it's encouraging that we have adapted with some good successes, and we have reached a lot of good things in the past few months. An example, Mr. Kamal Kishore, member of India's National Disaster Management Authority and co-chair of the Global Facility for Disaster Risk Reduction and Recovery of the World Bank. He highlighted 5 lessons learned from the recent cyclone Ampane in the response in India in June of this year. Firstly, revise the standard operating procedures or SOPs for evacuation. Secondly, repurpose existing capacities, resources, and tools. Thirdly, protect the responders. Fourthly, reduce any additional burden on hospitals and prepare them for what is to come. And 5, apply the classic disaster risk management principle. Focus on the most vulnerable first. Another example is the work by the United Nations Office of Disaster Risk Reduction. They took the business continuation planning tool and the quick risk estimation tool, and result of a research project on business resilience funded through the Asia Pacific Economic Cooperation, or APEC. And they added the COVID-19 related issues to it and aspects and launched these revised toolkits in the 3rd quarter of this year. ADPC had the opportunity to develop a series of online learning modules to provide a walkthrough of these toolkits. And these can now be found on the regional DRR online learning platform hosted by ADPC. In this difficult time, we have found that network approach to disaster risk reduction is a very effective and productive approach. ADPC is a very good example of this. No one can claim that they can do everything, and it is only through the combined effort of relevant stakeholders that we are able to move towards a goal of reducing disaster impact. And with the travel restrictions, it's even more important to tap into existing local resources and organizations to seek their support and help. We have the opportunity to support such a network in Thailand, the Thai Network for Disaster Resilience, or TNDR. This is a network made up of 15 universities in Thailand, where they are combining their effort on multidisciplinary research on disaster resilience and trying to support the Thai government agencies and organizations to apply their research in practical ways on the ground. I strongly believe in the usefulness and effectiveness of such an arrangement, and I would highly recommend other countries to follow in the footsteps of Thailand. The next example is the use of technology to facilitate online meetings and massive open online courses, or MOOC. Before COVID-19, MOOC was just at its infancy stage, with online courses offered mostly by academic institutions such as universities and higher education organizations. With the restrictions on travel, the new norm has certainly upended the normal in-person training, but the situation has also presented new opportunities as well. A lot of organizations, including ADPC, have now moved into the e-learning or MOOC modalities. Over the past few months, we have numerous new online courses at international, regional, national, and even local level, utilizing different delivery methodologies. Tape presentations like this one, live teaching, blended learning, online discussions, forum, and groups. All trying to recreate the in-person training experience. We still have a long way to go, but I believe that the innovation and available technology, we will get there. The last example is how best to learn from the value experience of COVID-19 in Thailand, for example. With the funding support of the World Health Organization and working closely with the Ministry of Public Health in Thailand, ADPC is documenting the learning and new hospital operational model developed by a pilot hospital in southern Thailand, and how this can be applied to other hospitals in the country and provide possible policy recommendations to the government. The aim of these policy recommendations is to strengthen the overall emergency management capability of the Thai government through more effective integration and linkages between the national disaster management mechanism and the public health sector. This is an issue that may be relevant to many other countries as well. As COVID-19 will probably be with us, or at least be seen as a threat for the next few years, it is important for us to speed up our adaptation to the new norm through partnerships and focused approaches. ADPC will be very happy to share its experience and its best practices, and we hope that we will be able to contribute to the overall process. With the gathering of so many DRR researchers and practitioners in this 21st ACC, I look forward to hear more about the ideas and research in the coming days to address the new normal, so to say. I would like to end my remark by expressing my appreciation to the National Research Foundation of Korea, Chungbuk National University, and Safe Today for sponsoring the 21st ACC event, and I look forward to a very active and productive discussion. I wish everyone a successful 21st ACC. Thank you very much.